Hello dear students, welcome to this channel once again. So last class we were discussing about the tricuspid atresia. Okay, so which was half we have discussed. Now let us discuss the remaining part of tricuspid atresia. So now let us discuss about the diagnostic evaluation. How to diagnose this condition. Okay. So first one is history collection. So history should be collected from mother, whether she had excessive alcohol during pregnancy, whether she had heavily smoked during the pregnancy, whether mother had any teratogenic infection during first trimester of pregnancy, whether mother had any drugs she has consumed during the first trimester of pregnancy, and we can also collect history from the mother that whether the baby is any suffering from any chromosomal abnormalities. Okay. So other history, whether the mother had any diabetes mellitus, okay, maternal insulin dependent diabetes mellitus, whether she is suffering from that one. So all those information related to tricuspid atresia we have to obtain. Next one is physical examination. So we have to do physical examination of the child. Okay, first we have to examine for cyanosis. Cyanosis means bluish discoloration of skin, nail, skin, nail, lip and tongue. And we can also examine child for optimum achievement of height and weight. Okay, then we have to assess the vital signs for any tachypnea, increased respiration rate. Okay, then dyspnea we have to assess, then whether there is increased heart rate, so that also we have to assess. Okay, whether the child is having any shortness of breath, dyspnea, so all those we have to assess during the physical examination. Next one is ultrasonography. So ultrasonography means during the pregnancy only, when mother undergo anomaly scan, so by this ultrasonography we can make out tricuspid atresia through the anomaly scan. Okay, so when mother undergoes anomaly scan, we can make out this tricuspid atresia during the pregnancy itself. Okay, next one is 2D echo. So when the child is made to undergo 2D echo, so that will reveals underdevelopment of right ventricle and proper development of left ventricle, and also it will also reveal the congenital absence of a tricuspid valve. Okay, next one is a cardiac catheter. So in cardiac catheterization, what do you do here? This is the heart. This is superior vena cava. This is inferior vena cava. Okay, so this is the right atrium, left atrium, right ventricle, left ventricle. Okay, so here a catheter is inserted. Okay, so this is a femoral vein. You can consider this is a femoral vein. So catheter is inserted from the femoral vein and it is advanced up to the inferior vena cava. Then catheter is advanced to the right atrium. After that, dye is injected. Okay, dye is injected. Okay, usually the dye has to flow from right atrium to the right ventricle. So here, because of there is a congenital absence of a tricuspid valve, there is no movement of dye from right atrium to the right ventricle. Instead, it will move from right atrium to the left atrium through the foramen ovale. Okay, so this reveals that there is no tricuspid valve and it is a condition of a tricuspid atresia. So this is about the cardiac catheterization. Now let us discuss about the management. So the management, first one is medical management. So we are managing this tricuspid atresia under medical, surgical and nursing. Okay, so first one is medical management. So first one is infusion of prostaglandin. Okay, so what happens when we infuse the prostaglandin? So when you infuse the prostaglandin, okay, so this is a pulmonary artery. Okay, this is the pulmonary artery and this is the aorta. Okay, so what is this? So what here the prostaglandin will do? So this is the aorta. Okay, this is the aorta. This is the aorta, and this is the pulmonary artery. This is the pulmonary artery. So there is a opening between the pulmonary artery and aorta is present. This is known as ductus arteriosus. This is known as ductus arteriosus. Okay. So on administration of this prostaglandin, it will maintain, it will keep this ductus arteriosus remain open. Okay. So how it is going to help in tricuspid atresia? When this ductus arteriosus remain open, so there is a shunting of blood from aorta to the pulmonary artery. There is a shunting of deoxygenated blood from high pressure aorta to the pulmonary artery. That is how it is increased. It will lead to increase pulmonary blood flow, increase oxygenation of blood, and increase oxygenated blood supply to the peripheral tissue, thereby we can reduce the cyanosis. So on administration of prostaglandin we can reduce the cyanosis. Next one is we have to correct the anemia. If the child is suffering from this tricuspid atresia and it is also suffering from anemia, so we have to take action to correct the anemia. If you do not take any action to correct the anemia, that will lead to development of congestive cardiac failure. The child will easily develop the congestive cardiac failure. So what action we have to take? We have to advise the parents of the child to give a iron rich nutritious diet, that is a jaggery, okay, green leafy vegetables, beetroot and groundnut, okay. And we can also suggest we can also give supplementary iron tablets can be given, so that will increase the iron level and reduces the iron deficiency anemia. And we can also transfuse the blood if required, if the child is suffering from very severe iron deficiency anemia, okay, so we can go for the blood transfusion. Next is correction of fluid and electrolytes. So when the child is suffering from tricuspid atresia and if it is also suffer from fluid and electrolyte imbalance, we have to assess fluid level and electrolyte level, serum electrolyte level we have to assess, and if there is an imbalance we have to take action to correct the fluid and electrolyte imbalances. Okay, so this is all about the medical management. So now let us discuss about the surgical management of tricuspid atresia. So surgical management consists of surgical procedures that are modified Blood Dowsing shunt, pot shunts, waterstone shunt, Glenn shunt and Penton shunts. So these are the shunts we are using in case of a tricuspid atresia. So let us discuss one by one. So that is modified Blood Dowsing shunt. So what do you do in this one? So this is the heart. This is the aorta. Okay. So here there is this is a subclavian artery. Okay. So this is right subclavian artery. Okay. This is right pulmonary artery. Okay. So what you do in modified Blalock Dowsing shunt? So here an artificial pathway is created. Okay, artificial pathway is created between the right pulmonary artery and right subclavian artery. Okay, so between the right pulmonary artery and right subclavian artery. Okay, so in this modified Blalock Dowsing shunt, an artificial pathway is created. Surgically, the artificial pathway is created from right pulmonary artery and right subclavian artery. Okay, so because of this, what happens is there is a shunting of blood from high pressure in the right subclavian artery to the right pulmonary artery. So because of this, what happens here, there is a more and more pulmonary blood flow, increase oxygenation of blood, and increase oxygenated blood come to the left side of the heart. On contraction, there is increased oxygen supply to the peripheral tissue, thereby the severity of cyanosis can be reduced. Okay. So what you do in modified Blalock Dowsing shunt? So here we have a aorta. Okay, so the branches of aorta is this is subclavian artery. Okay, this is a right subclavian artery. Okay, so this is a right subclavian artery. So this is the right subclavian artery and this is the pulmonary artery. This is the right pulmonary artery. Okay, so here the surgeon will artificially create a pathway between right pulmonary artery and right subclavian artery. Okay, right pulmonary artery and right subclavian artery. So because of this, what happens here? The deoxygenated blood after the contraction of left ventricle move through the aorta and then it will go enter into the subclavian artery. So there is a shunting of blood from high pressure. There is a shunting of deoxygenated blood from high pressure in the right subclavian artery to the low pressure in the pulmonary artery. So this will increase pulmonary blood flow, increase oxygenation of blood, and after the oxygenation blood will enter into the left atrium and then it will come to the left ventricle. On contraction of left ventricle, the blood supply to the peripheral tissue. There is a oxygenated blood will supply to the peripheral tissues. thereby it reduces the severity of cyanosis. Okay, so basically it is a palliative surgeries. Okay, all these are palliative surgeries. Next one is PART surgery. Already I have discussed this PART surgery in my previous classes. That is in case of a tetralogy of pelvic. So this is aorta. This is pulmonary artery. So this is left pulmonary artery. This is right pulmonary artery. So this is this is descending aorta. This is descending aorta. Descending aorta. Here what you do in case of a PART shunt, and surgical pathway is created between the descending aorta and left pulmonary artery. Okay, so this is left pulmonary artery. So an pathway is created. Okay, this is the descending aorta and this is the left pulmonary. So an artificial pathway is created between the descending aorta and the left pulmonary artery. So because of this, what happens here? There is a shunting of deoxygenated blood, high pressure in the aorta, descending aorta, to the low pressure in the left pulmonary artery, and that will lead to increase pulmonary blood flow, increase oxygenation blood, and again oxygenated blood comes to the left side of the heart, and on contraction of left ventricle there is increased oxygenated blood supply to the peripheral tissue, thereby we can reduce the cyanosis. Okay, so what we do in case of this PART shunting? So surgeon will create a artificial pathway between the descending aorta and left pulmonary artery. So on contraction, what happens here? The deoxygenated blood will come to the left ventricle. No, on contraction of left ventricle, the blood will be emptied into the aorta, and this deoxygenated blood, which is present in the aorta, okay, with the high pressure, that will shunt to the left pulmonary artery, and there is an increased pulmonary blood flow, increased oxygenation of blood. Then increased oxygenated blood come to the left atrium and left ventricle. Then on contraction of left ventricle, there is a increased oxygenation blood supply to the peripheral tissues, thereby severity of cyanosis will reduces. Next one is waterstone stenting. Already this waterstone stenting is also discussed in tetralogy of pelvic. So this is a ascending aorta, this is arc of aorta. Okay, this is aorta. This is a pulmonary artery. Okay. So here, what you do in waterstone stenting? Here, an artificial pathway is created between the ascending aorta. Okay, so where the pathway is created? So this is a right pulmonary artery, and this is ascending aorta. Okay, this is ascending aorta. So an artificial pathway is created between the, okay, so this and this. So right pulmonary artery and ascending aorta. Okay, an artificial pathway is created between the ascending aorta and right pulmonary artery. So because of this, what happens here? There is a shunting of deoxygenated blood present in the aorta. Okay, there is shunting of deoxygenated present in aorta to the pulmonary artery. Okay, so because of this, there is increased pulmonary blood flow, increased oxygenation of blood, and oxygenated blood comes to the left side of the heart, that is left atrium and left ventricle, and then after the contraction of left ventricle, again there is a supply of good amount of oxygenated blood to the peripheral tissue, thereby it reduces the severity of cyanosis. Okay, so that is a waterstone stent. So what we do basically in waterstone stenting, and surgeon will create an artificial pathway between the ascending aorta and right pulmonary artery. So thereby there is a shunting of deoxygenated blood, high pressure in the aorta to the low pressure in the pulmonary artery, right pulmonary artery. So this will to increase pulmonary blood flow, increase oxygenation of blood, increase oxygenated blood will come to the left atrium through the pulmonary vein and it will go to the left ventricle. On contraction of left ventricle, the increased oxygenated blood go to the peripheral tissue perfusion, thereby it reduces the severity of cyanosis. Next one is Glenn shunt. So what we do in Glenn shunt? This is superior vena cava. This is so this is right pulmonary artery and this is left pulmonary artery. This is superior vena cava. Okay. So here what the surgeon will do in Glenn shunting. Okay. Surgeon creates an artificial pathway between the superior vena cava and right superior vena cava and right pulmonary artery. Okay. So the surgeon will create an artificial pathway between the superior vena cava and right pulmonary artery. So because of this what happens here, the deoxygenated blood, okay, when while entering it into the right atrium, okay, it will enter into the right pulmonary artery and directly the blood will go for the oxygenation. Then oxygenation of blood will take place and oxygenated blood will come to the left atrium, left ventricle. On contraction of left ventricle, the blood will go for the peripheral tissue perfusion. Okay, so directly the blood is made to the blood, deoxygenated blood is directed from superior vena cava to the right pulmonary artery. So there is increased pulmonary blood flow, increased oxygenation of blood, and increased oxygenated blood will come to the left atrium, left ventricle, and contraction of left ventricle. There increased oxygenated blood supply, oxygen blood will go for the peripheral tissue perfusion. This will reduce the cyanosis, thereby improving the oxygenation of tissues. So this is Glenn shunting. Next one is Penton shunting. Okay. So what do you do in Penton shunting? This is superior vena cava. This is inferior vena cava. Okay. This is the pulmonary artery. Okay. So here, in case of Penton shunting, what the surgeon will do here? Surgeon will create an artificial pathway between the inferior vena. So this is the inferior vena cava. Okay. This is superior vena cava. Okay. This is the right pulmonary artery. So the shunting is created between the right pulmonary artery and inferior vena cava. Okay. So shunting is created between the shunting. Surgeon creates an artificial pathway between the inferior vena cava and right pulmonary artery. So because of this, what happens here? The deoxygenated blood, okay, which is coming to right atrium through the inferior vena cava. So that blood will go to there is shunting of blood from inferior vena cava to the right pulmonary artery. So this will lead to increase pulmonary blood flow, increase oxygenation of blood. Okay, that will lead to increase oxygenated blood from the left atrium, left ventricle, and then increase oxygenated blood go to the peripheral tissue perfusion. Thereby, it reduces the severity of cyanosis. So this is all about the surgical management of tricuspid atresia. Okay. Now let us see what is the nursing management. Okay. Nursing management is, first what you have to do, we have to correct anemia. Okay. If child is suffering from anemia, Along with the tricuspid atresia, we have to take all the actions to correct the anemia. It may be supplementation, iron supplementation to the baby, transfusion of blood, or it may be advice of iron-rich diet to the parents of the baby. Okay. Next, fluid and electrolyte, electrolyte balance. Okay. So we have to take all the action to correct the fluid and electrolyte imbalance. We have to administer the fluid as required, okay, as advised by the physician, and we also administer the electrolyte if it is deficient. Then we have to check vital signs. Okay, the child vital signs has to be continuously and closely. We should monitor height and weight. We should monitor height and weight of child. Okay, most importantly, we have to, first priority is we have to administer supplemental oxygen. Okay, this is first priority. Okay, so we have to administer supplemental oxygen, as this is a cyanotic congenital heart disease. We have to administer the child supplemental oxygen. Next, okay, we have to educate parents to avoid child strenuous activities. Okay, strenuous activity, the activity which cause strain and overload on the heart. Okay, like outdoor sports or weight lifting, such activity should be avoided, because this causes increase the cardiac overload and it also increases the oxygen demand. So that's why we have to ask the parents of the child to not to indulge their child for any strenuous activities. Okay. Next, perioperative nursing care. Okay. This includes preoperative, intraoperative, postoperative care. So when surgeon is planned for any surgical procedure for the child, so we have to take all the interventions for preoperative, before the operations, during the operations, and after the operations we have to undertake. Next one is follow up. Okay, the child is closely, we have to follow up. Okay, we have to do the follow up of the child after the surgical interventions. Okay, and the parents of the child has to be educated to come for the follow up care. Okay. Next, we have to administer medication. Medication should be administered as advised by physician. Okay, so we have to administer medication as advised by the physician. So this is all about the nursing management of tricuspid atresia. So this is all about the total in detail discussion about tricuspid atresia. Okay, so if you like this video, please press like button. Okay, and share it to your friends as well, that so that it will be helpful for them. And if you are not first time visitor to my channel, please subscribe to the channel. Please share this video to all of your friends. Thank you very much. Thank you.